Sam, are you ready to go ahead and get started? I think.
Yes, I think that everybody's here. It's just 1 minute past the hour, so we're very excited, and I think that we should go ahead and get started. First of all, thank you to everybody for joining us today. We'd like to welcome you to World Thrombosis Day 2021 and our campaign overview. We are incredibly grateful to have all of you here today and we also hope that you are all healthy and safe where you are, and that you are taking care of yourself during this crazy time. Before we get started, I want to do a couple of introductions for us, and a little bit of housekeeping, then we'll jump right into the presentation. So the first thing I'd like to do is I would like to introduce you to the World Thrombosis Day campaign team. My name is Sam Nelson. I am the campaign manager of World Thrombosis Day, and I am joined here today by Barbara Krolak. She's our senior campaign specialist. And we also have Mariana Gamboa, who is our membership and senior coordinator. You guys, if you are a Latin American partner, you may have been in contact with Mariana at some point, because she leads our translation program. And we also have Andy Maston, who's our marketing coordinator, on the line today as well. And we are your World Thrombosis Day team. If at any point in time, not just today, but also throughout the entire year, if you have questions or concerns, or you just want to bounce ideas off of us about how you can participate in World Thrombosis Day, please don't hesitate to reach out to us. We are completely full access for you, and we are here for our partners 100%. And anything that we can do to help further raising awareness of thrombosis, we will do it. So we are very thrilled to have you here and appreciate your presence. The other thing before we get started, couple of housekeeping items. The first one, which is a very exciting one, is that everybody that is on this call today is eligible to win a World Thrombosis Day prize pack that's worth over $200. We will pick the winner later on today, and we will reach out to you if you've won. And this is a very great prize pack, so hopefully you will enjoy it. It's worth about $200 United States dollars, so it's a pretty great gift of prizes. So what we're going to do today is we are going to introduce you to the World Thrombosis Day campaign and share the WTD plan for 2021. We are very excited about this. We have activities that are happening throughout the entire year, not just on October 13th, which is something that we're very excited about. We hope that this inspires you to join us for these events that World Thrombosis Day is leading, in addition to creating events on your own that will help raise awareness of thrombosis and help change lives and save lives. So we hope that we inspire you today, and we hope that you will join us for all of the exciting activities that we're about to share. For those of you that are new to the World Thrombosis Day campaign, I'm going to quickly go over who we are and what we're all about, so that you're able to really understand what our mission is and what our goals and objectives are. Then I'm going to pass it over to Barbara, and she's going to talk a little bit more specifically about what we are going to be doing this year. If you have any questions at all throughout today, feel free to write them down in the chat below. We do have time at the end, so we will be looking through those questions, and we will answer them at the end, but you're welcome to put your questions in that chat anytime during the presentation. Again, please keep your phones muted so that everybody can experience the joy of this presentation together. So World Thrombosis Day is a campaign of the International Society on Thrombosis on Thrombosis and Hemostasis, otherwise known as ISTH. You know, don't say that whole thing very often because it's so big, the words. But we are a global membership organization that works to advance the understanding and the prevention and diagnosis and treatment of conditions that are related to thrombosis and hemostasis. So that's our overarching association that World Thrombosis Day falls under. WTD is the awareness campaign of the ISTH, and our goal is to increase global awareness of thrombosis, including its risk factors, signs and symptoms, and evidence-based prevention and treatment. Our ultimate goal is to reduce the death and disability caused by the condition. That is our number one priority, and we want to do that, and we hope that you will join us to do it this year. Our campaign is led by an incredibly talented group of doctors, thrombosis and hemostasis doctors from around the world. We are led by Professor Beverly Hunt. She is our steering committee chair. She's out of the United Kingdom. And we also have Claire McClintock, who is our vice chair, and she is out of New Zealand. These doctors that we have on this steering committee are some of the top doctors of the world, and they come from all over the world. So we hope that we're very honored to be working with them, and we're founded in science, and we're supported by these dedicated experts, and we could not do it without them. We also have two very special members of the steering committee. We have two patient representatives that sit on the steering committee. These, Barbara's going to talk a little bit more in depth about the award, but the two patient representatives that we have are actually our Ambassador of the Year award winners. One of the prizes that you receive as WTD Ambassador of the Year is that you actually get to sit on the WTD steering committee for a period of 2 years, and you act as a patient representative, which is really important, and it gives that patient perspective within our steering committee meetings and our strategic meetings and in our planning. So being a part of that is definitely a huge benefit. And if you're interested in that, please listen to Barbara when she's talking about the Ambassador of the Year award later on today. So that's our steering committee, and we love them. They're just fantastic. So a little bit about the campaign goals and our campaign audiences. I'll talk about that in a moment, but first I want to touch on our objectives. The first one is our objectives are to highlight the burden of disease and the need for action, specifically around venous thromboembolism or VTE and AFib. You can read through all of these. I'm just going to go through them quickly. Increase public awareness and of the significance, the risk factors, and the signs and symptoms of thrombosis, specifically VTE and AFib as an important cause of thromboembolic stroke. We want to empower individuals to talk with their healthcare providers about their risk for thrombosis and appropriate prevention. That goes back to our mission in helping reduce the death and disability caused by the condition. We also want to encourage individuals to seek immediate medical attention if they have those signs and symptoms. That's really important, especially in the time of COVID right now. You really can't wait to go get checked out. So you'll hear us speaking a lot about that this year. We want to get all of the organizations in countries around the world to conduct appropriate and aligned campaigns in their countries and regions, which is one of the reasons why we're on this call today, so that we can all come together and collectively have a strong World Thrombosis Day presence, not only on October 13th, but also throughout the entire year. And then we also advocate for systems of care to properly prevent, diagnose, and treat AFib. That particular objective is really focused within our global policymakers, that audience, and the WHO, and getting mandated systems of care and VTE risk assessments in hospitals around the world. Excuse me. Our campaign goal, this is our overall campaign goal, and it does never change, is to increase public awareness of thrombosis, specifically VTE, including the risk factors, prevalence, and ultimately reducing the death and disability. You'll hear me say that a lot, that our goal is to reduce the death and disability caused by thrombosis. We have three main campaign audiences. So the first one is the general public and the patient community. And we want to speak to them and help them understand thrombosis. We want to share as much information as we possibly can and to give them ease whenever, during diagnosis, post-diagnosis, and during treatment. Healthcare professionals. We are very dedicated to making sure that our healthcare professionals have the information that they need to properly treat patients. Our scientific steering committee comes into play greatly with this because everything that we send out is vetted by them, so it's backed by science. And then also, as I mentioned before, global policymakers. The other piece that I'm going to talk about is you're going to see this year our content. What the content focus is basically what you're going to be, the messages that are coming from World Thrombosis Day that are phased out to the public. So these are the messages that you're going to be hearing us speak about. You're going to be listening to information on COVID-19 related thrombosis. Obviously, this is something that has come up in the last year. There is clearly a correlation between blood clots and COVID-19. And this is a worldwide piece that we need to make sure that the right information is being disseminated. So our content will be not only for healthcare professionals, but also, again, we're working with policymakers and we're working with patients and the public to make sure that they are taking care of themselves and they understand the risk of thrombosis and the signs and symptoms. We're also going to be continuing our messaging on cancer and thrombosis and also gender-specific thrombosis. So men's and women's issues surrounding thrombosis. You'll see those messages, and all of our activities and information that we're providing to you will be focused around those topics. Our creative, which is what it's going to look like this year, is that's kind of our brand. The story behind the brand is going to be Eyes Open to Thrombosis again. We introduced this last year. It's our primary creative of 2021, and it taps into that feeling to shine a spotlight on the risk factors and signs and symptoms by focusing on the eyes, which are really the window to the mind. So you'll see a lot of us talking about Eyes Open to Thrombosis. You'll see we use the hashtag Eyes Open to Thrombosis, along with our hashtag WTD21. So that's where you'll see a lot of that creative. Our next piece is, let's talk about our components. We have lots of different components to our campaign. We are goal-oriented. We have a clear mission and we have a clear focus. We know exactly what we want to get, and you guys are going to be there to help us achieve these goals. We have a lot of we have a lot of engagement. Our goal is to be engaging and encouraging, and patient voice, testimonials, published science and social participation, media coverage, everything online. So there's going to be a lot of engagement. We are going to encourage you to participate quite a bit, and we hope that you will. So it's going to be a lot of interaction this year. From an education point of view, we have we're doing quite a bit on journalist outreach, our patient community knowledge, making sure that we have the right information for the patients and the information that patients want. We're going to be sharing academic work and research that comes directly from our steering committee, and HCP resources and tools, so that if you're a healthcare professional, you are able to share the information as needed to keep your patients safe and to educate others within your hospital community. Our call to action is no thrombosis. Join the campaign and participate in 2021. And then, just as we do every year, at the end of the year, we'll share all of our metrics and we'll make sure we'll share our impact so that you know how much we've done and how much you have done to help raise awareness of thrombosis. We made incredible strides in 2020, and we've made incredible strides over the last years. And we want to continue that and continue to grow this, because thrombosis needs to be at the forefront of everybody's mind. And that is what we plan to do. How do we plan to do that? This is what I'm going to tell you. And Barbara will talk a lot more about these tactics in detail. This is a list. I don't need to read the list because you can all read it, but these are just some of the campaign tactics that we use to engage and to achieve our goals and our mission. You'll notice that this year we're going to, as I mentioned before, we do have a lot of engaging activities this year, so we hope you will participate and join us. These tactics right here that are listed, this is a great screen to screenshot, because you can use any of these things to help plan and prepare for your World Thrombosis Day events coming up. You can think about using contests or sending out a newsletter. All of these are great ideas that we are begging you to borrow. So feel free to borrow them. And if you have questions about them, you can always reach out to us because we are available. I'm going to talk quickly last thing before I turn it over to Barbara, is that I'm going to talk a little bit about some of our tactical highlights for this year. So we are going to be doing a lot of updating in our collateral this year. You'll see some updated toolkits, flyers, posters. I mentioned that Mariana is going to be working on our translation program. We are building out a brand new translation program that will allow you to have the ability to translate our materials into your own native languages, which will again help raise awareness and spread the information that we feel is so necessary. We also have, our goal is to develop 10 new downloadable items, but I wouldn't be surprised if you saw more than 10. So keep your eyes open on the World Thrombosis Day website. It will be, all of our updated materials will go under our campaign resources. So you'll see that, you'll see those updates. And of course, we'll let you know over email also and social. We have an incredible strategic media outreach plan. We have partners. We have a media agency, Stanton Communications, who is on the line with us today, that we'd like to say thank you to, because they are sidekicks, and they have put together, we have Global Media Markets. They've put together a very comprehensive plan, in addition to a rapid response program and reporter education and media training. Through all of the efforts that we have, our goal is to secure 5 billion media impressions. That's a lot of media impressions. Some of our tactical highlights, I'm going to let Barbara talk a little bit more in depth about them, but you will see a lot on social media from us. I would encourage all of you to participate in our social media. Follow us on the platforms that you have accounts on. If you're, Twitter, Facebook, Instagram, YouTube, LinkedIn, and TikTok. We are on TikTok. So we encourage you to make sure that you use our hashtag WTD21 anytime you're posting about World Thrombosis Day or about thrombosis in general. We will retweet you. We will make sure that your messages go out. So social media is going to be a big piece, as it always is. And our goal is to secure 500 million social media impressions, and we need your help to do that. So make sure you're using the hashtag, you're following us, and you're participating in all of the exciting events that we have coming up. I am going to pass it over to Barbara now, who is going to share a little bit more in detail and in depth about some of the tactics that we are going to be hosting this year. And Barbara, I'm going to pass it over to you now.
Thank you, Sam. Appreciate it. Hi, everyone. I'm Barbara Krolak. I'm the campaign senior specialist for World Thrombosis Day. I've been with the campaign almost 6 years now, and as I'm looking through the participant list today, I see so many names that we've enjoyed working with over the years. So thank you to those who have been with World Thrombosis Day many years, and welcome to those of you who may be new partners or just joined last year. It's great to have you here. If you'd like to, I'd like to invite everyone in the chat box, if you'd like to include how many years you've been involved in World Thrombosis Day. That's really helpful information for Sam and I to see who we're talking to today, if we have a lot of new partners or some veteran partners, as we like to say. So feel free to include that, share that in the chat box. So I'm going to start with social media here. And I always like to say this is the fun part, right? Almost all of us are on social media at this point. So if you have a Facebook or Twitter account, what have you, this is something that you can participate in. You'll see here that we've really expanded our social media offerings. And this is because we heard what you said last year. We had our partner survey. And
I'll get myself a bagel. You want anything?
let me
I'm good.
down you. And the number one feedback that we received from you, actually, well, there were two top things. One was more social media offerings because it's easy. Everybody can participate in that, particularly, during these times with the pandemic, it can be difficult to have in-person activities, which we completely recognize. So digital and social media offerings are a great way to support the campaign. The other thing from the survey, just real quick, we heard from you is you'd like to see more collateral, more free flyers, posters, informational resources. So I'll talk a little bit about that in a minute, but we just want you to know that we heard you, we recognize that, and we've built that into our plan for 2021. So here you'll see a couple of different things for our social media planning. One is our new Reddit Ask Me Anything series, or called an AMA. For those of you who are new to Reddit, this is another social platform where we bring in different experts and they answer absolutely anything, any questions that people have related to thrombosis. And it could be thrombosis and COVID, it could be women's health issues. We have different topics, but we are doing 4 to 6 of these this year. This is a new platform for us. So if you're not on Reddit, we would encourage you to create a free account and join us for the next one. We have one coming up actually in a couple weeks for Blood Clot Awareness Month. So we are very excited about that. We also have our Ask the Expert video series. We launched this last year, so this may look familiar to you, but these are kind of side-by-side videos that we're doing with different experts globally to answer kind of the burning questions that are happening today. Last year, we did a couple related to COVID. This year, we're planning to do at least one video in Spanish, recognizing that that would be really valuable to our Latin and South American partners. A couple other things for social media. We'll be doing live streaming events. You probably recognize Sam's beautiful face. She's been our host for our Facebook Live series that we launched last year. Those were a great success, so we are definitely planning to do those again, and we're hoping to also launch that on Instagram as well. So if you're on Instagram or Facebook, you'll see some of our live streaming events. We encourage you to attend. If you have any suggestions for topics that you'd like to see for these that you're not seeing, please, drop it in the chat, email Sam and I. That's such helpful information. We want to make sure that we're covering topics that are important to you and that your community wants to hear about. And then finally, a couple kind of more administrative logistical things. We have our advertising program. This is where we work with Google AdWords and other advertising means to put the World Thrombosis Day message out there on a bunch of different platforms. And then we'll be doing a formal countdown, just like we always do, to World Thrombosis Day. This usually starts at the end of September around World Heart Day, leading up to October 13th. This year, you can expect a really big splash on social. We want to make this as easy as possible for you to support and participate as a partner. So we're going to be rolling out special graphics that you can download and share. We're going to be having a few different digital events leading up to that, so stay tuned. But that's going to be a really fun and easy way for you to participate. Next slide, Sam, thanks. So here are a couple of different things. So Sam mentioned earlier our award program, and this is one of my favorite programs because this is our opportunity to recognize partners, patient survivors who have really just done an incredible job supporting the World Thrombosis Day campaign mission and making a difference in your community. So we have 2 awards coming up. You'll recognize our Activity of the Year award. We launched this last year, so it's still a bit new, but this is great for partner organizations. So if you're an organization or you're kind of the representative for a group, this is a great one to consider. We'll be looking at a group who organized an outstanding event or activity in 2020. So this could be virtual, which most events were virtual last year, just given the circumstances. It could be an in-person event, really anything. We'd love to see what you came up with, and we'll be recognizing a partner who went above and beyond and was very creative to celebrate World Thrombosis Day last year. The other award is kind of geared toward individuals. So the Ambassador of the Year award is for typically a thrombosis patient or a survivor who is now kind of pivoted to the awareness realm afterward and is doing great awareness work in their community. Again, this is a great one for an individual. This one does have to be nominated by someone else. So if you are a survivor yourself and you'd like someone to nominate you, you can send it on to a friend or colleague, or you can go ahead and nominate someone else. In 2020, our Activity of the Year award winner was Thrombosis Ireland. I invite you to go to our website and take a look at their Stop the Clot Roadshow event. Very cool, really, really neat, and it might inspire you for something to do this year. Our Ambassador of the Year award winner was Federica Fedeli from Italy, who now serves as a patient representative on our committee, like Sam was sharing earlier. So stay tuned for more on those. We'll be opening up the award season in April, so it's just right around the corner. And definitely go ahead and get your nominations in early. We get a lot. So we're looking forward to that, and please let us know if you have any questions about awards. I'm going to go ahead and pivot over to some of our other tactics related to public affairs and stakeholder engagement. From the public affairs side, as many of you know, we have been working with the World Health Organization for many years to get VTE prevention on the agenda from a global public affairs scale. This is really work that is headed up by our team, and particularly the World Thrombosis Day Steering Committee, where we work with the patient safety group and with the COVID-19 task force. So throughout the year, you'll see updates from us about how that work is going. If we need partner volunteers to help support some of that work, we'll certainly share that through email. So just keep that in mind. If that's something that you are interested in helping support, please let us know. And then from a stakeholder engagement, a healthcare stakeholder engagement side, we have a lot of different stuff coming up this year. Our premier Twitter chat, this is something we've done going on 6 or 7 years now. One of our most popular events. We'll be doing that again this year, as well as our global webinar that we host with the Centers for Disease Control and Prevention. We have new scientific publications coming up. I'll talk about that on another slide. Our Awareness Day collaborations with other groups. And then something exciting this year is the charity run for the Isth 2021 Congress. So this charity run will be fully virtual, and we're hoping that this is something that our WTD partner community can engage in and support. We'll be sharing again more on that, but that will be taking place in July. So this will be a virtual run that you can join. So just kind of keep that on your calendar as something to do in July. If you have any questions as I go through this, please feel free to go ahead and drop them in the chat. Sam and I will keep track of them, and we'll address all the questions at the end of the webinar. Okay. So research and academics, this is a really important one because this is something that's led again by our scientific steering committee, and these research papers and publications are really kind of what go out to the scientific community on behalf of the World Thrombosis Day campaign. This data is so important, particularly now as we are navigating a world amid COVID. Blood clots are at the forefront more than they ever have before. Thrombosis has received more media attention and scientific attention, I would argue, than ever, because we're seeing that correlation with COVID. And so while it's been an incredibly challenging year, it has been valuable to have thrombosis at the forefront and have a lot of people's attention as we see how the two are connected together. So you'll see that we have some research coming up this year that's related to COVID-19 and thrombosis. We'll also be working on an editorial looking at the review on patient care. And then another piece that will look at the VTE risk stages in hospitalized patients. So again, this is something that our steering committee will be working on, but we often go to different partner organizations to see what's going on in your country and how we could leverage that data. So stay tuned for that.
I felt a really good spark.
Okay. A couple fun things here for campaign enhancements. You'll probably appreciate seeing here that we have a new campaign website coming up this year in 2021. We are looking forward to giving our website a full refresh. We've gotten great feedback from you all about what works well on the website and maybe what we can improve to make it easier for you to navigate and to find the materials that you need. So that is going to be happening over the next few months. And then on the patient engagement side, the first thing here is our My Clot Story campaign. I just want to pause here because we have received the most incredible response from you all in our global community for this. We started My Clot Story a couple years ago, just as a way for people to be able to share their survivor stories. And we have received hundreds and hundreds of stories. We have so many right now, and we're looking forward to receiving more. So just thank you for your support of that program. It's really been one of our most successful campaigns. We'll also continue our patient testimonials, the Ask the Expert videos like I talked about earlier. And then two things here I want to point out to you. One is our video contest. We're going to be launching a video contest a little bit later in the year where people can do and submit a quick video for World Thrombosis Day. It could be something fun like a dance video or an exercise or something, or it could be a quick talk or how your community is celebrating World Thrombosis Day. But we're going to have a contest around that. We're going to be launching more details over the next couple of months. But this is a great way to get involved, to show your support. The contest is fun because we'll have a great prize. This is also a great thing if you have a younger cohort in your community that wants to get involved. We've seen high schoolers, college students, young professionals that love getting involved in stuff like this. So this would be something great to pass along to them as well. The second thing on here I want to make sure you see is our artwork contest. Again, this is going to be launching in a couple months, but we're going to have an art contest where all of our partners and community members can submit a piece of artwork for the World Thrombosis Day campaign that we're actually going to be putting on a product and sell in our online merchandise store. So the winning artwork will be likely on a face mask and maybe a t-shirt that we'll sell in our store that represents World Thrombosis Day using our logo. So stay tuned for that. But again, if you're creative or someone in your organization's creative, this is a really fun one to participate in. So here we just wanted to give you a really high level look at the timeline for the year. Obviously, this does not have everything on it, but this is a nice, 10,000 foot bird's eye view of what we have coming up. You'll see we already had our World Cancer Day activities, and we launched the call for new My Clot Story submissions just a couple days ago. Coming up in April, we'll be launching our awards program like we mentioned. July 17th to 21st is the Isth 2021 Congress, and that's also when we'll be doing that virtual charity run. In July, we'll be closing the award nominations. And then in August and September, those are our two really busy months. That's when we'll be launching those contests that I told you about, the video and the artwork contest. We'll be having a lot of our social programs during that time, as well as throughout the year. And then in October, those 2 weeks, October 1st to the 13th, we're going to have so much stuff, from our Twitter chat, our webinar, social media countdown. We'll be releasing some new collateral at the beginning of that month. So I'm really excited for that. And there's going to be a lot going on in that lead up to October 13th. And then at the end of October, we have World Stroke Day as well, which is a really important one. So we'll share more on that as we get closer to October. So that is a nice overview of what we have coming up this year. Before we jump into the Q&A, I just want to say I know what a challenging year it was last year for everybody all across the world. And, we are just so impressed by the creativity of all of you with, the activities and ideas that you come up with. As Sam mentioned, we had a higher global campaign reach and participation last year than we ever had before, even despite a pandemic and so many other challenges happening. So I can only imagine what we'll accomplish this year. So thank you, and I'm going to go ahead and pass it over back to Sam for our Q&A portion.
Thanks, Barbara. That was a great overview of what we're going to do, and it gets me excited every time I go through this presentation and we get to share it. It gets me excited for the year, and it really does. It makes me so proud to be a part of this organization, but it also gets me really excited because I feel like the activities that we have planned this year are going to be fantastic. We hope you feel the same way. So looking at the questions, I did see one from George that says, will there be any materials focused on e-thrombosis? George, that's a great question. We actually are working on putting together some material, a whole new set of materials, and one of those items is e-thrombosis. And we also will be having some, in addition to e-thrombosis, you'll see one-sheet flyers on items like inherited risk factors. That's another one that we're going to put on the website. So you will be seeing updates to that. And the next question from Eric Vanderberry, very good question. That is actually flowing right into what we were just talking about, is will WTD touch on highlights of rare clotting disorders? One of the items that I just mentioned is that we will be doing some one-sheet informational sheets that have information on those clotting disorders, so that when you're first, one of the thoughts that we had is when you're first diagnosed, what do we need to provide information for? So there will be informational sheets that will focus on things like factor V and May-Thurner's and APS, and giving a brief introduction to those and where to find additional information. So those are both great questions. Okay, I see I have Dale Blumen here, 4th year. Glad to have you back, Dale. What are the dates associated with the patient engagement activities? So the patient engagement activities, we do not, World Thrombosis Day, October 13th, we will have our Twitter chat on that day. We will also hold our educational webinar on that day. Those are our two primary World Thrombosis Day activities. We have a list of Reddit AMAs that we are confirming, and we can publish those at a later date. And then
I think Dale, are you asking about the two contests, the patient contest, the artwork one and the video one, perhaps? For those will be launching closer to World Thrombosis Day. So we'll have more information coming out in July, and then those will actually open up in August. So you'll see those a couple months from now. We will be sharing information earlier just so that you can prepare and have the details on hand, but that will actually be opening up for submissions in August.
Okay, the next question that I received down here is, how can I share my event activity and can it be added to the WTD partner calendar? That's a great question. So you actually are able to go under the World Thrombosis Day website, the current website that we have. You can go under and you can add your event and it will show up on our calendar. When we launch our new website, we will have the same ability to do that, where you can enter in your event. It'll show up on our calendar, and we are always happy to support you. So we love getting events, especially when they're throughout the year. So send them through the website and we will make sure that they show up. The next question, 2 and 3 years ago, this is from Jeremy. We got good media interest on TV and local radio in Southeast England. Last year, we seemed to clash with another organization. Corey, Mental Health Week. Is it possible to avoid clashes? That's a very good question. Barbara, do you want to answer that?
Yeah, we hear this a lot. First of all, we totally recognize this, and this is a challenge for any awareness day, not just World Thrombosis Day. So 2 recommendations here. If you're finding that there's other awareness days that are coming up around World Thrombosis Day, and so you're having a hard time getting media attention, we would recommend reaching out to your sources earlier, even earlier than you think, just so that it's on their radar. And when these other activities come up, they'll already be thinking, well, I know World Thrombosis Day is October 13th. That's already top of mind for them. Reach out more than you think. It's just good to kind of have that cadence of communication with them throughout the year, particularly with media, because they're always looking for stories. And as we've talked about, we're really evolving World Thrombosis Day into a year-long campaign. So there's opportunity for media outreach all throughout the year. We're doing that ourselves from headquarters. So if you're finding that there are other weeks that are clashing with yours, maybe talk to your local media about doing something earlier in the year around Blood Clot Awareness Month, which is this month. You could do something over the summer. It doesn't necessarily have to fall right at or around World Thrombosis Day. The other thing is, I hope I'm interpreting your question correctly, but if you mean that there's other organizations that are working on World Thrombosis Day stuff and maybe you're both reaching out to the same groups, I don't know if you mean that, but we see that happen as well. We recommend you can reach out to us and we can introduce you to some other organizations that are also involved in the campaign in your area so that you can link up and work on and collaborate on outreach together.
That was a great answer to that question, Barbara. So I hope that we answered that, Jeremy. And if you have any further questions, please feel free, again, to reach out to us and we can further clarify that. Aaron, I didn't mean to call you Eric. Aaron Vanderberry asked, what is a good way to get started in community engagement, especially during a pandemic? This is a fantastic question. And I'm really glad that you asked that because it is really difficult right now. We're all in our homes. It's a little bit more difficult to get out and about and do the boots on the ground type of awareness activities that we traditionally do. One thing that I would tell you is that social media is incredibly powerful. We found that you can create or join patient engagement groups, and that is a really great way to engage like a much larger community. If you're looking for something on a more local level, what I would do is I would reach out to your local doctor. If you're a patient or a survivor, the first thing I would do is talk to my doctor about participating in the World Thrombosis Day campaign and partnering with them, because chances are your doctor is associated with a hospital, and then you can use him or her to go and work on a larger scale within the hospital. Even if it's just, you may not be standing in a booth at the hospital, but you might be able to have the opportunity to provide information for a newsletter or provide materials which can be printed out. And so you can provide those items for them even while you're at home. Building the relationship is the most important thing, because if you have that relationship, you can help it grow. So if you're a patient or survivor, I would say start with going through your doctor. I know as a patient myself, I talk to my doctor about World Thrombosis Day quite a bit. Probably because he's associated with World Thrombosis Day, but it's a really good starting off point within your community.
One other thing too, sorry, just to jump in on that one, I was thinking while we were talking to Sam, for Aaron's question, another good place to look at for community engagement, particularly right now, is looking at like your county or your town government, reaching out to their community engagement contact, local fitness facilities, gyms, hospitals, all those places like that. We're all in the same boat right now where it's challenging to have these in-person activities with the pandemic. So everyone's going virtual and hosting more webinars than ever before, online exercise classes, online workshops. So go to those groups and say, hey, I'm, planning a World Thrombosis Day activity. Could I have a segment of your webinar? Could I help lead something for an online workout class or whatever it may be? And most of the time we hear that they say yes, because they're just as eager for content and activities for their stakeholders. If you need some more ideas though, feel free to email Sam and I and we can talk through that with you more.
And another great idea is to hook up with partner organizations. So if you're an individual, our partner organizations are around the world and they do such incredible work. And so if I'm going to use Thrombosis UK as an example. If I lived in the UK, I would probably hook up with Thrombosis UK and find out what activities they're doing as well. We have over 2,800 partner organizations around the world. So, a lot of times if you're, say you don't get like a good answer from your doctor, you can always reach out to maybe a local partner organization or a regional partner organization to try to help further your awareness activities. Leslie Lake just made a great question, and she said, I work with another patient advocate group, and how can we work more closely with you? Well, Leslie, we're very excited to work with you. The best thing to do is just email us. We love working with other organizations and help furthering our partner organizations, their activities and their awareness, and we would love to work with you. So feel free to reach out to us. We'll set up a meeting. We'll talk about what you would like to achieve and what you guys would like to, your goals are, and then we'll help provide resources and we'll help provide you with whatever we can. So Leslie, I hope to see an email from you soon. We absolutely will put our emails in the chat. The easiest one is wtd@isth.org. That goes to every single person within the campaign. So we are not just, World Thrombosis Day is not just the four of us. World Thrombosis Day is every single partner organization and individual that works together. We all work together and we are all here to help you. So please do not hesitate to reach out to the campaign team. Okay, sitting still for 90 minutes reduces the flow through. I'm gonna mess this vein up and I apologize. I'm not gonna even try it. Popliteal vein by 50% insufficient to induce VT, so must be dealt with carefully on the community level. That is a very good point. And one of the things that we can recommend is that if you are going to do a long webinar or a long talk like this, I very highly recommend that you get up and you stand up and you stretch. And that's even something that you can do within your virtual activity. We're coming to the end of this call, but if it was longer, I would say let's take a break and stand up. That's something that I would definitely engage and have everybody do, especially in a virtual environment. So thank you for making that note. That's very important to remember, to get up and to move, especially every 90 minutes. I actually have an alarm on my watch that reminds me to get up. So good point. Are there any other questions? I'm sorry, Barbara, did you have any?
I was just going to note too, I think, Zanat, your point there is, from a community level, we have to be careful with, stay at home recommendations. We're encouraging people right now to physically distance and stay at home. And so they're working from home, yet then we're also saying it's dangerous to sit too long. So that is a very, touchy, sensitive thing, and that's a line we have to walk. But I think it is, like Sam said, a great opportunity to say, just to take those breaks. Here are some things that you can do to significantly lower your risk. And like we said earlier, because blood clots are so top of mind right now, that's great for media outreach or community outreach or whatever you're doing.
Yes, absolutely. And that message is so important. So as partners and individuals, you can share that message. And we do have social media images that we can share with you that speak to getting up and continuing to keep that blood flow, especially now with COVID-19 and stay-at-home restrictions that are so different around the world. So that is very, very key. I like thank you, George, to seek out partnerships with stand-up desk manufacturers and the airline industry. That is something that we work very hard to do outside. And if you have any contacts, feel free to drop them to us as well. Are there any other questions? We have about 10 minutes left, and we can wrap up a little bit early, but we don't want to let anybody go without having answered all of the questions today. So we'll give you just a couple more minutes.
Just a quick reminder, we have recorded this today, so we'll share the recording with everybody, and please share it with your colleagues or other people who work on the campaign with you, or if you even have some friends who you think would be interested, send them the link. This is a great time to get involved in World Thrombosis Day because we have more virtual digital activities than ever, so anybody can really participate. So even if your sibling or a loved one or a friend who's maybe never really even heard of thrombosis, invite them to join, because we have activities for people like you who have been involved for a long time and for people who are just learning about it. So thank you for spreading the word.
Actually, that gives me an idea. We're going to challenge everybody on this call to reach out to 3 people. and have them join the campaign today. So if we can have if everybody could get 3 people to join the campaign today, that would be fantastic, because then they can acknowledge, then it would be better if it was we'd love for you to have your organization or your hospital join if they haven't joined already. And if not, reach out to 3 people that you know and share your info, share about blood clots today. Explain to them the importance and why it's important to you. I do that every day. I've run out of people. So now I'm just going to the general public. Well, we are going to wrap up our time today. It looks like the questions have slowed down. We look forward to working with you this year. 2021 is going to be a fantastic year for World Thrombosis Day, and we are absolutely thrilled to have you be a part of it. So again, if you have any questions, please don't hesitate to reach out to us, the World Thrombosis Day team. And we very much look forward to working with you this year and and to keep life flowing and to keep eyes open to thrombosis. So thank you for your time, and we will talk to you all soon.
Thank you, everyone. Have a great day.